I mainly use ESWT on scar tissue, but scar tissue is very hard and fibrous, so I use high energy. But I decide energy level by scar tissue degree, area, and the duration after the surgery or procedure. But I use low energy for regeneration or lymph circulation, especially to face. And when I want to use ESWT on this delicate area, I use gauze or my hand. Okay.
But I strongly believe that if one starts very low and slow, you can even manage it in very painful locations and patients as well.
Okay.
So I would, from my point of view, I would encourage every, say, aesthetic or plastic surgeon to consider at least shockwave to implement in their treatment regimen, because we can reduce complications, we can accelerate the healing because lymphatic drainage is facilitated in the face or on different locations. I have some patients referred to me after, say, a thigh lift or everything else where lymphatic issues are, and the shockwave can improve the lymphatic outflow. So it is not a question of whether to use shockwaves or an operation, but in my view it is quite wise to combine it even. So you can still perform your facelifts or whatever treatments you want to do, but increase your results and reduce your complications with the application of additional shockwaves. That's my strong belief.
Do you have any special combination program, surgery, pre-treatment, after treatment with ESWT?
Yeah, usually there is even scientific evidence that, for example, a pre-treatment 1 day before tummy tuck operation, you can improve the scar quite significantly with the Vancouver scar scale. So if you pre-treat once your area where your scar will be, you will have a more pleasant scar afterwards. So you can pre-treat and post-treat, or precondition and post-condition the tissue, because after, say, after facelift, for example, you might encounter some swelling, or breast surgery, for example, where you have big wound sizes and issues, and you can, if you then apply post-operatively shockwaves, you can facilitate the healing of the tissues. So I would do it both before and after the operation.
그러니까 이제 수술 전후에 이제 케어로서 ESWT를 사용하면은 이제 수술할 때 운드의 크기나 이 상태도 더 좋게 할 수 있고, 특히 후에도 드리네이즈를 빨리 시킨다거나 해서 수술 전후에 프로그램을 함께 운영하는 것도 많이 사용을 하고 계신다고 합니다. 그러니까 저는 수술을 하는 의사는 아니기 때문에 이제 저 같은 경우도 리프팅하는 울사라피 같은 거라든지 다른 이제 머신을 사용한 리프팅을 할 때도 저도 이제 전 관리나 이제 후 관리를 중요하게 생각하는데, 서전으로서도 또 ESWT를 그 자체로도 잘 사용하고 계시고 전후 케어로도 함께 같이 수술과 함께 잘 쓰고 계시는 걸로 말씀을 주셨습니다. I use shockwave a lot because it's been proven with good results at my clinic. The shockwave don't harm the tissue when we use it properly. Not only it improves the lesion tissue, but also the surrounding area because of its regeneration effect and circulation enhancement. But I think this method requires enough clinical experience.
There is, I fully agree, there is a learning curve in shockwaves. So it is not only choosing and buying the right machine and then have good results, but then it starts like with surgery. So if you have a scalpel, you can buy a scalpel, but you will not be a very good surgeon. But there is a learning curve, and this is in shockwaves as well. We are, as the International and the German Society, we are providing courses, shockwave courses, and we just had last week our German shockwave 2-day course where I spoke myself 4 hours on shockwaves in cellulite, in lymphatic drainage issues, and on the face. So we are providing education for physicians who will do shockwaves in these special areas as well. So there is a learning curve, yes.
are there any other plastic surgeon in Germany like you? For example, you can operate and you can use ESW to wear into any other indication.
So I have colleagues who are using it. We have good results in combination. For example, if you do cryolipolysis and shockwaves, you have better results than with cryo alone. We see I do a bit of scar treatment, for example, with with percutaneous rolling, with the percutaneous induction things, with medical needling, for example. We see good results. I have colleagues combining it with lasers, even in combination for cellulite or for different locations. So there is a good, in my view, argument to combine it even with other measures.
Which subspecialty deal with cellulite or lifting laser in Germany?
In Germany, we have both the plastic surgeons and the dermatologists. So the dermatologists, there is a branch in the dermatologists who are going into the aesthetics. So it is aesthetic dermatology where they do botulinum, they do a lot of laser work, and they do these kind of issues as well. Because the stronger plastic surgeons are more orientated towards surgery usually in Germany.
독일에서도 그래도 성형외과는 주로 수술 쪽을 더 많이 하지만 이제 성형외과에서도 이런 뭐 셀룰라이트 레이저 적용이라든지 뭐 이런 것들을 같이 함께 다루는 분들이 좀 있다고 얘기하시는데요. 사실 우리도 마찬가지긴 한데 우리도 더 많은 분야가 사실은 이런 에스테틱 메디슨을 하고 있기는 하죠. You told there is a ESWT session in Plastic Society in Germany. Are they popular or are there any other special society for ESWT group?
Okay, we have in Germany we have the German called DIGES, which is a German shockwave society for musculoskeletal issues, built in 1995, the oldest shockwave society in the world. And I'm the general secretary of it, the CEO. We are there focusing on musculoskeletal, but also on neurology. And we have a different society for urology. So erectile dysfunction, chronic pelvic pain is done by urologists. And we have a German urologist shockwave society. But both societies, the German shockwave MSK and the German urology shockwave, are now trying to, let's say, be on conferences together to broaden our experience. So last week, Jens Rassweiler, who is the president of the German urologist, was there 1 month ago. I came to the urologist meeting in Hamburg and spoke there on our view of how shockwave. So we try to interconnect much closer now.
You are the leading one for them.
Yes.
Okay.
I'm busy.
Yes, you look very busy. 보통 근골격 쪽에 체계 충격파 적용하는 게 아무래도 제일 이제 많고 그랬지만 그 외에도 신경과 쪽이라든지 뭐 유럴로지, 뭐 비뇨기과 쪽에서도 활발하게 하고 있고요. 그래서 이제 그런 것들을 서로 세미나나 학회를 함께 하려고 이제 개최하려고 많이 노력을 하시고 그래서 많이 다니시면서 같이 활동을 하시느라고 많이 바쁘다고 하십니다. 네. Thank you for joining today. And you arrived today just 2 hours ago. Very nice to meet you and thank you.
Thank you, Dr. Ko. Pleasure being here with you all.